Hi, everybody. My name is Dr. Abby Allen.
And I'm Dr. Sheena Ranade.
We're part of the Mount Sinai Health System. We are pediatric orthopedic surgeons at the Mount Sinai Health System. And in the spirit of the US Open, we thought we would discuss childhood injuries and sports injuries and how to prevent them.
So we have obviously pediatric practices. So we treat athletes who are little bittle toddlers all the way up to adolescents. And so we have a lot of perspective on how we can prevent injuries, the kinds of injuries we see, and hopefully this will be educational.
And I think we have a great perspective as being surgeons and moms. So maybe we can discuss that a little bit too. So why don't we start with, I don't know, Dr. Ranade, what do you think, what kind of injuries do you see in your practice in your patients?
So I have a lot of little kid athletes in my practice who are very focused on one sport in particular. And I think especially as we get towards adolescence, kids tend to find the thing that they like the most.
Mm-hmm.
And then, parents are really supportive of their desires to play the one sport over and over and over again. So kids will end up being on multiple teams all year long. So a lot of what I see in the older athlete, the adolescent athlete, is overuse injury. Overuse injuries are due to repetitive action multiple times, and in the growing athlete, there are a lot of parts of the body that are still developing, and it can lead to injury. So I like to encourage parents to limit the amount of doing any one particular sport to about 5 hours less than the age of the child. So if they're 15, I say 10 hours a week is ideal. This is variable per family and per child as far as how comfortable they feel with that. But I think it's a pretty safe rule.
I've never heard that before, and I like that. I might start using it. I think that in general, I think listening to bodies, and if you, reasons to maybe back off would be pain. If your child is having pain, it's probably an overuse injury going on. So maybe back off a bit, or even bring them in to see us or your local pediatric orthopedist or pediatrician to get evaluated.
I think that's a really good rule. Kids' bodies don't like to, they don't like to let you know when they're having pain. So if they do, it's probably significant.
Mm-hmm. So limping, if it's a leg, as an example, limping, not wanting to do the sport for some reason, those would be some other reasons I would say to bring them in. And what activities do you think, Dr. Rana, your kids are a little younger than mine, so you have toddler age kids, I have a little older age kids. What kind of activities do you think are good to do right now at your age? And when do you think you should start playing sports?
I think the concept of sports is different for different age groups. So I have a 3.5 and a old. So in my 3.5-year-old's age context, I think that sports are really good for learning how to cooperate amongst children, how to work together in a group. And so when we talk about sports activities, it's really usually like a class kind of environment where they're playing together, potentially. And right now with COVID, it's a little bit limited, but ideally learning how to interact with other kids, share the ball, things like that is the main goal. But, when kids get a little bit older and are closer to your kid's age, starting elementary school, I think that it shifts. Like, what are you looking for your two littles?
I think the idea of sports and collaborating with other children of the same age is good, not for physical health, but mental health as well. So I think it's good. I think in the spirit of the US Open, I think tennis is actually a great sport to play right now, especially given COVID-19, which is kind of the elephant in the room. It's a sport that you can play with others, but kind of still stay separate. So I think these more non-contact, individualized sports are really good options right now to kind of stay in the mix and stay with friends, but not zero risk, but lower your risk given the COVID-19 situation. Obviously, I don't know where you're listening to this from, but it changes based on area. So definitely look at your local area to see what's going on before doing anything. But I think tennis and individualized sports are great.
Yeah. And I think right now, you alluded to the mental health benefits of exercise. And I think that for kids right now that aren't getting out, aren't doing their normal levels of activity, the mental health benefits of just having your kid go out, kick a ball with them and run around with them can be, massive. So just the opportunity to get some energy off, to use your body in a really, positive and, family-oriented way too can be great.
Mm-hmm. I think from a musculoskeletal perspective, given that we do pediatric orthopedic surgery and treat these children with injuries, I think some things to look for as parents, because we're parents too, and when to bring them in are if a child's limping, if a child continually has pain, if you see an arm or a leg, it's not in the right position that it should be, then that's you should probably bring them in sooner. Swelling, those are kind of some of the general reasons to bring them in for an appointment. If you are in our area and want to make an appointment, all you have to do is call these numbers down here, and we'll help you out.
Yeah, and I think, for the older athlete, if you have a throwing athlete in particular, if they're starting to throw slower, they're less in control, those are also signs that something is brewing. And the most important thing, the one thing I harp on the most, I think, with my athletes is please stretch. Make sure your kids are stretching before and after practice, especially if they're playing the same sport a lot. That's really great for preventing injury. And then try to, right now is a great time to spend time with your kids, but also try to find ways to keep them active, whether it's just taking them outside for a family walk or however you can make it work right now. But we're all just trying our hardest. So hopefully our kids will see how much we care and how hard we're trying, and know that the doctors are still here. We're still here to help if you need us.
Yep. So maybe leave some comments if you would like, or questions. We'd be happy to answer them. But we hope to see you on the courts rather than in our office, but know that we're always here if you need us.
Take care and stay safe.
Bye-bye.